Hello, I'm Dr. Steve Hotze, and welcome to our webinar, which is part of Dr. Hotze's Wellness Revolution. So we are pleased to have you here today. I believe that everybody, including you and me, are responsible for our own health. Nobody else is responsible, not your spouse, not your doctor, not your government, not your insurance company. You are responsible for your health. I'm responsible for my health. And I believe most health problems are preventable. And I also believe that drugs and pharmaceutical companies produce and that are written by conventional doctors are toxins and will make you sicker quicker. So I believe that you can get yourself on a path of health and wellness naturally by finding a doctor and a staff of professionals who have the wherewithal and know how to coach you how to be healthy and well naturally so you have energy, vitality, and enthusiasm for life. Today, we're going to talk about two main topics. One, exosome therapy systemically for several key systemic diseases. And secondly, I'm going to talk to you about the coronavirus and the mass hysteria that's developed around this. So let's talk about exosomes first. Exosomes, stem cell exosomes, are the biologically active molecules that are produced by stem cells, which are the pluripotent cells in our body that are used by our body to regenerate and revitalize damaged tissue. So whenever a person has an injury, your body is going to send stem cells to that area of the body. It was thought that the stem cells would morph into the cells that were damaged and injured. As it turns out, they produce exosomes, which are the biologically active molecules, the proteins, the peptides, the uh, leukotrienes, the growth factors, the anti-inflammatory cells or molecules that enable your cells to regenerate and revitalize themselves so they get healthy. It also modulates the immune system and decreases inflammation. These are what exosomes do. Now, exosomes come from stem cells. Think of the stem cells as a refinery. Refineries take crude oil and convert it to petrochemical products like gasoline, diesel, propane, butane, various petrochemical products that are then sent to various companies that use the petrochemical products so they can produce their products. Your car's low on gas, low on oil, you go to the gas station. What do? You put in refined oil, maybe into your engine, or you put gasoline more likely into your tank. That's been produced by the refineries. You don't need a refinery in your car. You need the product of the refinery. So the stem cells are like the refinery, and the gasoline is like the exosomes. So think of it that way. So as it turns out, we're now able to acquire stem cell exosomes naturally uh, through in where we derive these is from full term pregnancies that are delivered by cesarean section, and the placenta and the umbilical cord contain stem cells, embryonic stem cells, from uh, that were used to help that baby develop and grow. And then those stem cells are plated out and grown in a media that allows the exosomes to be produced, and then the exosomes are extracted, which are not cells. The exosomes are the various molecules your body currently contains from your stem cells. All the stem cells in your body makes the identical molecules, the bioactive molecules that communicate with the cells and encourage them and stimulate them to revitalize and regenerate. So we can use the exosome, stem cell exosomes in two ways. When we get the exosomes, and by the way, they do come from laboratories that process the placenta and the stems and the umbilical cords and produce the exosomes. Those exosomes are then sent for sterility testing, which takes about 6 weeks to prove there's nothing abnormal, no bad bacteria or viruses growing in them. Also, that mother has been checked the day she has her delivery. Her blood's checked to make sure she has nothing in the blood that could be passed on through um,
through the placenta or the umbilical cord. And once sterility has been proven, then that batch of stem cell exosomes is released, and the various companies, the tissue banking companies that produce the exosomes, then sell them to various doctors and medical centers so they can use them for their patients. So there are two ways they're used. They're used systemically and they're used intra-articularly. Last week I talked about the use of stem cell exosomes for degenerative and osteoarthritis, primarily in the knee joint, in the hip joints, and in the shoulder joints. So what happens is 1 or 2 cc's of exosomes, which are purchased from these tissue lab companies that are sterile, that have been characterized so we know what's in it. They're mixed with protein-rich plasma from the patient's own body. We draw blood, spin the blood down, it separates into red blood cells and into platelet-rich plasma. They're mixed together. And then whatever joint has the problem, they're injected with the stem cell exosomes combined with the protein-rich, the platelet-rich plasma, as well as some Wharton jelly, which comes from the umbilical cords, and that's injected into the knee or into the shoulder or into the hip. And that stimulates the regeneration and revitalization of chondrocytes. Those are cells. Chondra is cartilage, cyte is cell. It's the cartilage cells. It's the cells that produce cartilage that cause cartilage to reform in the joints. Why is this important? Because it can help prevent you from having to have your knees cut out from underneath you and have a knee replacement or a hip replacement or a shoulder replacement. How much better would it be to get new growth and regeneration of your joints rather than having to get a joint replacement, which is very expensive, it's time consuming, and in 20 or 30% of the cases, it causes more problems. Oftentimes you get one knee replaced, it throws the other knee off. The next thing you know, you have to have the next knee replaced, or the same thing in the hips or even in the shoulders. So I like to say surgery often leads to more surgery, very commonly. The other thing that stem cell exosomes are used for are some systemic health problems. Now, Dr. Neil Reardon has written a book called Stem Cell Therapy, A Rising Tide. Now, Dr. Reardon established his clinic in Panama approximately 10 to 15 years ago, and he uses stem cells and stem cell exosomes for the treatment of a host of systemic diseases. We can't say that in America, we're not allowed to say that we can use stem cell exosomes to treat anything. That's just the rules of the FDA. But we know that they have been beneficial in other areas, in other countries, Japan, Europe, Panama, where the physicians are able to use and permitted by the governmental authorities to use stem cells and stem cell exosomes for intra-articular arthritis and for systemic problems. So what are some of the systemic problems Dr. Reardon has used these for with great success? Muscular dystrophy, spinal cord injuries, multiple sclerosis, heart failure. It's used as anti-aging for respiratory disorders like chronic obstructive pulmonary disease or emphysema, for autism, for ulcerative colitis, that's inflammation and infection and deterioration of the colon, for diabetes, for lupus, and for other autoimmune disorders. He's had tremendous success, and I want to encourage you to get a copy of this book, Stem Cell Therapy by Dr. Neil Reardon. And I'm so excited about this. We had wanted to do stem cell therapy in our practice, 5 to 8 years ago. And we were going to be able to pull the fat cells out of the body and take out the stem cells. And they were going to be given to a lab here in Houston, and they were going to grow the stem cells, and we're going to be able to inject the stem cells back in. Well, the FDA declared that the stem cells were drugs. And so we couldn't do that. We couldn't work with the company. That company since then is able to get the stem cells from from adipose tissue in people's bodies and grow it here in the United States, but they can't give it. They have to ship it to Cancun, Mexico, and people have to fly to Cancun to get their stem cell injections. Well, over the last 5 to 8 years, it has been determined and been shown demonstrably and clearly that it's the exosomes that are produced by the stem cells that really have the effect on regenerating and revitalizing tissue, modulating the immune system, and cutting down on inflammation in the body. So there are tissue lab companies that have arisen that process the placentas, the stem cells from placentas and umbilical cords, and then provide the exosomes for treatment in patients with joint disease and other systemic problems. So that's what we do here, and I've decided at the Hotze Health Wellness Center, we're going to do that here. We've been practicing regenerative medicine since we started back 30 years ago here at the center. Regenerative medicine is the opposite of degenerating medicine. Most of us, all of us as we age, are going to degenerate. We're going to deteriorate. Why? We don't eat healthy. We don't exercise. Those are two things you're responsible for. We eat the wrong kind of foods. We eat a high simple carbohydrate diet that's loaded with sugar, which causes inflammation. And all the simple carbs, the sugar, the grain products, the potatoes, rice, and corn all get converted to sugar. All they are sugar molecules hooked together. That's what starches are. That causes a host of inflammation and a host of health problems. It depresses the immune system, and it leads to inflammation through the production of insulin, which is highly inflammatory, and it affects the coronary arteries most commonly and leads to coronary artery disease. So we degenerate and deteriorate because poor eating habits, no exercise. Exercise causes the stimulation and production of stem cells, which produce exosomes, which keep the body healthy. Our hormone levels decline. We don't get enough vitamins and minerals in the foods that we eat because we're eating packaged food primarily. If it's in a food can or box, I recommend don't eat it because it's going to be low in vitamins and minerals. Our soil is low in vitamins and minerals because it's depleted, and we use fertilizers. We don't give the soil a rest, and so we deplete the minerals out of the soil, and we pick the crops too early so they don't get the vitamins setting in them properly, so we don't get the good vitamins and minerals that we need. So these are some reasons that we degenerate. Well, in Hotze Health and Wellness Center, we practice regenerative medicine. We teach you to eat healthy, good, whole, organic foods and cut out all the simple carbs. We also teach about replenishment of your hormones, your thyroid, your sex hormones, and adrenal hormones when indicated. We talk about vitamin and mineral supplementation. We help you detox with vitamin and mineral supplementation from all the toxins that you have in your body from petrochemical products and from heavy metals. And we also encourage good exercise program. A good, healthy exercise program, as I mentioned, is important to keep your stem cells active. We practice regenerative medicine here. If you're not in our program and you're not doing any of these things, your body is degenerating, it's deteriorating, and you leave yourself open to get all kinds of illnesses. And what happens? You get obese, you get diabetic, you get high blood pressure, coronary artery disease, you get dementia, you get Alzheimer's disease, you have strokes, heart attacks, kidney disorders, degenerative arthritis, gastrointestinal problems, a host of health problems that ultimately lead to your demise and to lead to an unproductive, unhappy, unfulfilling life because people that are sick and tired just don't enjoy life as much as people that are full of energy, full of vitality, and energetic about life. They just don't enjoy it. Look, I love life. I'm full of energy and vitality. I'm 69, but I've been on my program for 30 years. I believed it when I started it. I practiced it. That's the way I feel. And I'm going to continue. I'm popping. I'm sorry. I've been told by my director that my peas are popping, so I apologize. So anyway, we practice regenerative medicine here, and now the next step is exosomes. That's going to put us at a new level. So get up on our program, which involves also the treatment of airborne and food allergies. That causes degeneration. What I want you to do is get yourself on the Hotze Health and Wellness Center program. Come in and be seen. I encourage you to do that. And then we can help you with treatment with stem cell exosomes if you have degenerative arthritis or if you have some systemic problems. I am confident that we can give you a new level of health as you mature. So if you're alive, you might as well be alive. That's my story on exosomes. I want to encourage you to get the book Stem Cell Therapy by Neil Reardon. You can get that on Amazon. Get it and read it. That'll be a big boost to you. Now, why don't we talk about the coronavirus? The reason I'm breaking in and I'm not stopping with exosomes is I want to give you my inside track on the coronavirus. We have a severe case of mass hysteria. Hysteria. You've heard of people being hysterical? That's an old term. Hysteria is an old term from Greek physicians 1,000 years before Christ, who noticed that women, when they went through the change of life, when their hormones changed or during menstrual periods, had certain mood swings and changes. And they said, well, that's hysteria. Hysteria means a wandering uterus. That's right. Hyster is the term for uterus. It's kind of interesting how this term is carried over. So they said, well, the reason the women act this way is they have a wandering uterus. They knew it was some way related to the hormones because they had irregular periods or they had mood swings around their periods, or when they went into menopause, they had some severe, maybe some emotional problems. Maybe they got depressed. Maybe they had some problems with their mental focus and capacity. And as many have told me they have, when you go through the change, when your hormone levels go down, you're not going to feel good like you did when you were young and vibrant. That's just a fact of life. So anyway, mass hysteria is this whole concept of people don't think clearly. They're not thinking clearly. And it's a whole society. So mass hysteria is a phenomena that causes an irrational fear throughout the entire population due to an illusion. An illusion is a perception that's false. It's an idea that's false due to an illusion of a threat. Well, what is the thing that everybody is hysterical about today? The coronavirus, which, by the way, is it's nothing. You don't need to worry about it. It's mass hysteria and fear. I listened on the radio coming into work today for 30 minutes on Fox News. They were carrying on this whole concept about the dangers of coronavirus. Well, the current fear of coronavirus is an example of mass hysteria, which is being propagated by the mainstream news media. It's fake news, folks. Why do they talk this up? So they can get you scared to death, full of fear and anxiety. So you turn on that TV every day and watch it. So their advertisers can sell you products. They want you to watch the TV. They've got to have a crisis. And the crisis now is the coronavirus crisis. Well, let's put things into perspective. Coronaviruses have been around ever since the beginning of mankind. It's a common virus. We had the SARS virus, which was a virus that came out of China back in 2003 or 2004. And it was a respiratory syndrome virus caused by the coronavirus. Oh my gosh, it was going to kill everybody. And I think ultimately they had 10,000 cases in the United States and a handful of deaths. And it was called the severe acute respiratory syndrome. We've had MERS. We've had the swine flu. We've had the Ebola virus. Hey, not even talking about infectious disease. We had Y2K. We had mass hysteria about all these various diseases. I've seen it in my career over and over again, and it leads to nothing. Nothing ever happens. So let's just put things into perspective. Yesterday, which would have been February 26th, the United States Center for Disease Control reported that there had been 14 cases in the United States of the coronavirus and no deaths. That's all that they could come up with. Now, put this into perspective. Worldwide, there have been 80,000 cases of the coronavirus worldwide, of which 65,000 are in China. Now, China has 1.5 billion people. That means less than 5 people per 100,000 have contracted the coronavirus. There have been 27,000 deaths as of yesterday attributed to the coronavirus. Now, there got to be thousands of people that have contracted the coronavirus and have the symptoms and never ever go see a doctor and get well. just like you do on the flu. It's very similar to the flu in the symptoms it produces. Okay, 14 cases as of February 26, 2020 of the coronavirus. How many cases do you think we had of the flu virus in the 2018-2019 flu season? That's last year. You think we had 1 million? Think we had 500,000? You think we had 8 million? How many cases of the flu were in the United States last year? 61 million. That's 1 out of every 5 Americans contracted the flu virus, according to the Center for Disease Control. How many died? 57,000 people died of the flu last year. Nobody talked about it. There wasn't anything on TV. We get the flu every year. Everybody expects it. People die of the flu. Hey, we have a flu vaccine, which doesn't work, by the way. Worldwide, well, let's talk about the current flu season, okay? Since October 2019 to date, in the current flu season, we have, according to the CDC, approximately, and this is in their mid-range, 35 million people with the flu in the United States have contracted it since October. 25,000 have died. Put that in perspective, we've had 35 million flu cases this year with 25,000 deaths, and we have 14 people as of yesterday with the coronavirus in the United States. And what's taking up all the media time? What's the front page of the paper? The coronavirus. It's a non-problem. It's the chances of you getting coronavirus, much less dying from coronavirus, are slim and none. As Slim has left the station already. You got no chance, folks, but you got a 1 in 5 chance based upon the statistics of getting the flu this year. Okay, worldwide, every year annually, the World Health Organization estimates that 1 billion with a B people get the flu. And over 1 million people die of the flu every year. Now let's put that in contrast. 1 billion people every year, according to the World Health Organization, get the flu. And this year, we have 80,000 people that have got the coronavirus, COVID, the new coronavirus. There are different strains of the flu virus, the coronavirus. They all change every year. They change. This is called the COVID coronavirus D19. It's just another strain of the coronavirus, okay? Where it came from is debatable. But anyway, we've got this new strain of coronavirus. It's caused 80,000 people to date to contract it, 65,000 in China. We had 1 billion people every year. We have 1 billion people every year contracting the flu virus and 1 million dying. Okay, and by the way, when I first became aware of the coronavirus, there had only been 200 people that had it, and I think there were 2 or 3 deaths, and this was in China, and they made it the front page news. Somebody knew this was going to go on, and the mainstream media took to this, said, here's a new opportunity for us to get our listening audience back. So CNN and MSNBC and all these have taken up this banner, and even Fox News, because they want to get the people watching Fox. They go like, CNN's talking about it, NBC, ABC, CBS is talking about it. We better talk about it so we don't lose our audience, because everybody's scared to death of getting the coronavirus. When your chance of getting that are slim and none, but you got a chance of 1 in 5 of catching the flu this year. Okay, let's put some other things into perspective. Annually, every year, 600,000 people die of malaria. Most of these are children in Africa under the age of 5. Annually, 650,000 Americans die of heart disease. That's 1,800 daily. Yesterday, approximately 1,800 Americans died from heart disease, heart attacks, strokes. 1,800. We have 14 cases reported and diagnosed with coronavirus. And we have 1,800 people die of heart disease every day in the United States. Worldwide, there's 17 million deaths from heart disease. That's 46,000 per day. What about dysentery, which is an infection of the intestines. Usually it's a bacterial infection. It could be a viral infection. It could be caused by amoebas. 140 million people worldwide every day, worldwide annually, have dysentery. And about 600,000 people die every year from this bacterial infection in the bowels. That's 1,658 deaths daily. Do you hear anything about that? Is there any hype about that? No. In the last century, communism killed over 100 million people. In China alone, Mao Zedong killed 45 million through directly killing them or starving them to death. Stalin did the same thing in communism, in Russia. The same thing happened in Vietnam. What did they do in Cuba? People that did not support Castro's revolution were lined up on the beach and shot. Why do you think people flee communist countries? Why do you think they come over in waves and boats from Cuba? They've been doing that ever since the revolution back in the 1950s, getting out of there because communism destroys anybody and kills anybody who will not submit to the communist authoritarian regime. How many people have died in Venezuela from communism? I'll guarantee you, Bernie threat is a huge threat. Bernie Sanders is a much bigger threat to your health and your life than the coronavirus is. I'll guarantee you that. If the communists were to take over America, how many people would die? You know, Bernie Sanders said the other day, it's good for people to stand. It was good for people to stand in bread lines in Cuba because the people that had money had to stand in lines just like the poor people. That was great. That's Bernie Sanders' idea. The guy's an avowed communist, for crying out loud. He calls himself a Democrat socialist. The only difference between a socialist and a communist is a gun. Socialism has killed more people than all the coronaviruses put together and the flu viruses. Communism is deadly. That's what you ought to be concerned about rather than the coronavirus. We ought to be hysterical the fact that somebody like Bernie Sanders could be nominated by the Democrat Party, but the Democrat Party is a communist party anyway. We ought to be hysterical. Those that love freedom, those that love free enterprise, those of us that believe in religious freedom and freedom of the press and the right to bear arms, we ought to be terribly concerned about the fact that the Democrat Party the Democrat Party in America is the Communist Party in America. We fought communism for decades and beat them, and now they have come and infiltrated and taken over the Democrat Party. And none of those guys in the Democrat Party or gals are worth a hill of beans. They're a bunch of communists. That's their philosophy, Marxist philosophy. They can call it socialism. Socialism and communism are brethren, identical twins, basically. Okay. So how do you get the coronavirus? Same way you get the flu. Person-to-person contact. Somebody sneezes, somebody coughs, somebody simply talks, and the droplets come out. They float in the air. You breathe it in, and your body's either going to react and make your immune system is going to react and fight off the infection, or else you're going to contract it. If you're unhealthy, you're liable to contract it. Bacteria and virus tend to breed in people that are unhealthy. Healthy people don't get sick. It's unhealthy people that get sick. And we're going to talk about how you can get yourself healthy to make sure you don't get sick. Like the flu virus, the coronavirus can be transmitted in the same way through droplets. And you can contract it from somebody who maybe has been exposed to it but doesn't have any symptoms. So what are the symptoms of the coronavirus? Well, they're the same symptoms you get with the flu. You can't tell if you have the flu or coronavirus. What do you get? Fever, you get body aches, you get cough, you may get shortness of breath, you're fatigued, sometimes you get vomiting, sometimes you get diarrhea. The symptoms can be mild or they can be severe. And sometimes they can be fatal. I told you, this already in this season alone, we've had 25,000 people die from flu-related illnesses in America. Most of those are elderly, debilitated people that have, chronic obstructive pulmonary disease or emphysema. Those are the people that are most likely to have, people with diabetes and all these health problems are the people that are most likely to contract the flu or the coronavirus and develop the symptoms and have severe problems with it. The common individual, it's going to last 3 or 4 days. If you've ever had the flu, you have it for 3 or 4 or 5 days. You get the body aches, you get the fever, you don't feel well, you lay in bed and shiver. Then all of a sudden it breaks, your body builds up an immunity to it, boom, it breaks and you're done. You break a sweat, it's all over. So how do you diagnose it? Well, not very easily. You can do blood tests. They got to be sent off to the CDC, Center for Disease Control. It takes 1 or 2 weeks to get the test backs. I've read all about them. They're said to be inconclusive. They can't really, some of them are false positive, false negatives. By the time you get the result back from a test, you've already cured your disease yourself. Your immune system has fought it off. So the diagnosis would be based on symptoms, but guess what? The symptoms are the same as the flu. Who knows if you got a coronavirus or you got a flu virus? If you're a healthy individual, you probably don't need to worry a thing about it. You're going to do fine. It's only the debilitated people that need to worry. And if you're not in healthy shape, you want to get yourself healthy, and we're going to talk about how you can do that. So here's some ways you can prevent viral illnesses like the flu and the coronavirus. Wash your hands regularly. If you come in contact with somebody or you use a doorknob in a bathroom, so wash your hands. Keep your hands clean. If you sneeze, wash your hands so you don't spread it. Cough into the crook of your elbow here rather than onto your hands that you would then pass on to somebody else. Remain home when you're sick. Limit your contact with people that have got flu-like symptoms. Avoid refined sugar. Sugar, and that includes grain products, potatoes, rice, and corn. All those are simple carbohydrates that are converted to sugar. That depresses the white cells in your immune system and makes you more susceptible to infections, whether they're bacterial or viral infections. Take vitamin C on a daily basis. I'm a big advocate of vitamin C. It's antiviral and it's antibacterial in high doses. It stimulates the immune system to help you fight off the viruses and bacteria. So you can take it. I recommend you take 1,000 milligrams per 25 pounds of body weight. If you weigh 150 pounds, take 6,000 milligrams a day. If you weigh 200 pounds, take 8,000 milligrams a day. I have taken approximately 10,000 milligrams a day for the last 30 years. I'm up to now 15 to 20,000 milligrams over the last 2 to 3 years. It helps prevent coronary artery disease. It stimulates the immune system, and at high doses, if you take it IV, it can kill bacteria as well as viral infections. Take vitamin D3. I recommend during the flu season, you take 10 to 15,000 international units on a daily basis. I personally take 30,000 milligrams a day and have for years to get my vitamin D levels high. That stimulates the immune system. People with low vitamin D levels have an increased risk of heart disease, infections, and cancer, and a host of health problems. Vitamin D is a godsend. It's inexpensive. Take it. If you're coming down with flu-like symptoms or viral symptoms, remember the coronavirus and the flu virus can have very similar symptoms. If you get symptoms of a flu-like virus, you probably got the flu. You don't have the coronavirus, okay? And even if you did, it's not going to be any different symptom-wise. You don't need to go running off to the doctor. Take yourself vitamin D, and I would recommend 50,000 units for at least 3 to 4 days, say 4 days, to help stimulate that immune system and pump your vitamin C, double the dose that you're on. If you're on 8,000, take 16,000. Take an extra 1,000 milligrams every hour until you get stool intolerance. Say you're taking 20,000 when you get to you go trying to get to 20 and you get to 14 or 15,000, you get loose stools. Back off the next day to 12,000, about 75% of that dose, and that'll cut down on the loose stools. Also, vitamin A is very important, and you need to take a good multivitamin, and we have that in Energy Formula here at Hotze Vitamin Store. Take that. It's got 5,000 units per 3 capsules of vitamin A. If you're coming down with flu-like symptoms, you ought to take 10,000 milligrams. So take Energy Formula 6 capsules a day. You'll get plenty of vitamin B, which you need, plus other minerals and other minerals that help stimulate the immune system. We don't give a flu vaccine. I don't recommend a flu vaccine. Studies have shown that flu vaccines disrupt the immune system and can make you more susceptible to other viruses. You could take a flu vaccine And that would disrupt your immune system. That may make you more susceptible to getting the coronavirus or even the flu virus. By the way, the flu virus fails in 90% of the people. So a large proportion of people that get the flu have had a flu vaccine. But guess what? The flu vaccine is for the flu from the previous year. We don't know what strain of the flu is coming through this year, so you really can't vaccinate against it. It's a moneymaker for the pharmaceutical companies and for the pharmacies, but it doesn't help you. As a matter of fact, it depresses your immune system when you get these shots. Get yourself on good vitamins and minerals and nutrients. Get your hormone levels up. Eat healthy, exercise, and you don't have to worry about contracting an illness. You're going to be a healthy individual. You know, I could drop dead tomorrow, but I haven't had a flu symptom, and I don't know when. Decades. And the staff at our office, rarely does anybody ever, and we've been here 30 years, does anybody ever get the flu? We just don't see it. And yet 1 out of every 5 people in the country get the flu. So I know the proof's in the pudding, and I know if you eat healthy, you take vitamins and minerals, get your hormones right, exercise, you can solve a host of health problems by preventing those health problems, and that's what you need to do. That's what regenerative medicine does. It prevents health problems. It doesn't go and try to correct them once you've had them. It helps you prevent from getting them. Okay, so who benefits from all this hysteria? Well, pharmaceutical companies, right? People are racing out to get all kinds of drugs, Advil, all kinds of medication. They're getting their vaccines. And guess what? These companies now want to come up with a coronavirus D19 vaccine. It'll take a year and a half to develop. And guess what? Then they'll be able to sell that and sell it to millions of people that they've scared to death over getting the coronavirus. We know the flu vaccine doesn't work. Why do we know that? Because already this year, 35 million people have the flu. Last year, 61 million people caught the flu in the United States alone. And this year, 25,000 people have died. Last year, 57,000 people died of the flu. If the flu vaccine worked, friends, we wouldn't have those kind of deaths. Come on. And that's the problem. So you need to boost your immune system so you don't get the flu. There's nothing that the conventional doctor can give you that will prevent a flu from you contracting a flu. Nothing, including the flu shot. The media is fake news, and the coronavirus is being politicized. Guess who the Democrats are blaming for the coronavirus now? President Trump. He's allowing the coronavirus to come into our country as if he could put a wall of soldiers and block the coronavirus. What can the president do to stop any viral infection? Obviously, the politicians and the government and the CDC have not been able to stop the flu, which killed 57,000 people last year. Why do we think they'd be able to stop the coronavirus? They're not going to be able to. You have got to prepare yourself by getting yourself healthy and then not being around people that are sick. You'll never know if they have, 999,000 chances out of 100,000 if you come in contact with somebody that's got a fever, cold, he's got fever, body aches, fatigue, cough, congestion, he's got the flu. He doesn't have the coronavirus. So what they're doing now is they're blaming guys like Schumer, Senator Schumer, and these other Democrats. They're blaming President Trump, and it's ridiculous. President Trump was very measured last night. He came out and said the same things I said, the same things Rush Limbaugh said, and other doctors who are thinking have said, and other individuals who are thinking have said, who are thinking rationally, that this is media hype. It's all total hysteria. There's not going to be a pandemic of the coronavirus in America. We got a pandemic of the flu, and nobody seems to care because there's not really much you can do about it from a government or a health standpoint or for a health service standpoint. You've got to get healthy. Only you can keep yourself healthy. Your doctor can't. The government can't keep you healthy. If you think the government can keep you healthy, then I could sell you a bridge over water in the middle of Arizona. I'll guarantee you that. Oh, here's the latest. San Francisco, which has 0 cases of the coronavirus, has declared an emergency. Yeah, an emergency in San Francisco from the coronavirus. So they don't have any cases, but they got 8,000 to 10,000 people living homeless on the street, defecating in public and urinating in public. Think of the flies, think of all the disease that spreads, and they're using needles and they're shooting up with heroin. That's a problem they can't address. How are they going to stop a coronavirus which doesn't even exist there? And they declare an emergency. Why don't they declare an emergency about their homeless situation and the health hazards of having homeless people? Los Angeles has somewhere in the order of 50,000 homeless with the same situation. Can you imagine that? This is a sanctuary city. Oh, so these Democrats want to let anybody illegally enter our country without any evaluation whatsoever. Just let them cross the bridges. Let them cross the Rio Grande River or cross the desert, come into our country. What kind of diseases are they breaking? Do they not think about that? There's a whole lot more problem there, and diseases and also crime that they're bringing. There's a whole lot more problem there than to worry about a non-entity, the coronavirus. Whenever there's a new viral outbreak, this is what's happening. This goes back to the MERS, to the SARS, to the swine flu. People are egged on by this media echo chamber, which latches onto the story and it repeats it ad nauseum over and over again. It drills fear into the minds of the public and to investors. So recently the stock market dropped. Why did it do that? Because of the coronavirus. Well, did the stock market get infected by the coronavirus? No, but it got infected by hysteria. The same thing happens on social media. Rumors spread unchecked. It amplifies this perception that we have a risk. We've got to be worried about the coronavirus. At some point, and perhaps soon, the media will move on to another story. It'll get you all excited and hysterical about something else. I always say what happens is when the politicians want to do something nefarious, they start shaking a flag over here and making you worry about what's going on over here, and they're working behind your back to do something deceptive and nefarious. They want you to worry about this. They want you to worry about the coronavirus, of which there are only 14 cases as of yesterday. There may end up being 1,000 or 10,000 in the United States. Who really cares? Who cares about that? 10,000 is nothing comparison to 61 million cases of the flu last year. Our problem is not the coronavirus. Our problem is our perception, the illusion that it's going to be a life-threatening risk for all of society. Look in Milan, Italy. They quarantined the city. I think there were 20 cases I read. All the supermarkets were stripped of food, mass hysteria. You know what I'm here in Houston. We've had no cases of coronavirus. We've had hundred thousands of cases of the flu in Houston, but no coronavirus. Nobody stripped the shelves, but I guarantee at the supermarkets, people just expect it. Oh, if we had 5 or 10 cases of flu in Houston, I promise you what would happen. They'll shut down the schools. They won't allow any public sports to occur where crowds come together. They may ban church services. And, and just like in a hurricane, if you've been here in Houston, they'll strip the shelves. They will. I highly recommend that you go out and at least get yourself something to last for a couple of weeks. I don't care whether you get what mix you get, whether you get some rice, beans, you get freeze some steaks in the refrigerator or some meat, some hamburger meat. Buy some prepared meals, have them frozen. Then you got something to eat when these nincompoops, idiots, go hysterical and just strip the shelves in the supermarkets. So part of the exaggerated reaction to the coronavirus is linked to the fact that it's simply new and it's emanating from a foreign country. So we know what happened with the SARS virus. That was going to be terrible. There were fewer than 10,000 cases reported in the United States. 10,000, that's it. Remember, we had 61 million cases of the flu last year, and the flu killed 57,000 people. And people are dying every day. 1,500 people are dying every day or more. Between 1,500 and 2,000 are dying every day from heart disease in the United States. Well, that's preventable by replenishing your hormones, eating correctly, taking vitamins and minerals and nutrients, particularly vitamin C, will help protect and prevent heart disease. And you ought to be on 1,000 milligrams per 25 pounds of body weight. That will keep your coronary arteries from becoming atherosclerotic, from hardening. That's very important. But nobody's talking about that. They talk about selling you all kinds of drugs like statin drugs and antiarrhythmic drugs and a host of medication to help you prevent heart disease, and it doesn't stop the heart disease. You can stop it by changing your eating patterns, exercising, taking vitamin C, vitamins and minerals, and keeping your hormones balanced. That's and replenished as you age. That's what's key and important. Well, that's basically my story. So here's my takeaway on the coronavirus. Why don't you just use plain old vanilla common sense? Don't panic. Don't worry about it. Let somebody else worry about it. Boost your immune system. And I've told you how to do that with vitamin C, vitamin D, vitamin A, a good high vitamin mineral with B complex. And that would be the energy formula that we carry here at the Hotze Vitamin Store. Make sure you got to store water and some food. So when the public goes totally bananas over the coronavirus because 10 people in Houston got it, or 15, like they did in Milan, Italy, and like the mayor in San Francisco declares a public emergency against the coronavirus, which doesn't even exist in the city, when they've got all other kinds of health issues going on with the homeless. When all these idiots start terrifying you, just laugh at them and say, these guys are just totally crazy. I would call them bat S crazy. Have you ever heard that term, bat crazy? Well, that's exactly what these people are. And that's because they want to take this, they want to politically weaponize this coronavirus against Donald Trump. And they want to do whatever they can to undermine his presidency. He did a great job yesterday talking about very much the same things I talked about, how we don't need to worry about that. We got a problem with the flu. It hasn't destroyed our country. That's just something that goes on. Pandemics occur, diseases occur. Your job is to keep yourself healthy. There's no magic pill that will prevent it, but if you keep your immune system healthy, you're less likely to contract diseases and you'll live a healthy life. That's my story about the coronavirus, the mass hysteria surrounding it. Don't get caught up in it. Think rationally. Look, who gets caught up in this kind of thing? My mother told me, don't follow the herd. You'll get stampeded. You'll get run off a cliff. That's what happens. Don't be like sheeple. Sheeple are people who act like sheep. They get herded. That's what the MSM, the mainstream news media, the fake news, that's what they're trying to do. Give you this fake news. They're trying to herd you in a direction. Just laugh at them for the idiots they are. Okay, that's the way I feel about it, about this mass hysteria around the coronavirus. Okay, next week we're going to have our webinar at 1 p.m. Central Standard Time, and it's going to be how to prevent heart disease. And I'm going to encourage you to join us next Thursday, March 5th from 5 to 7 p.m. here at the Hotze Health Wellness Center as we launch our new service, Stem Cell Exosomes. 5 o'clock, we're going to have drinks, hors d'oeuvres, other refreshments. 6 p.m., I'll make the presentation about stem cell exosomes, and I look forward to seeing you then. This is Dr. Hotze saying I encourage you to get yourself on a path of health and wellness naturally so you can regain and maintain your health and wellness, so you have energy, so you've got vitality, and you're brimming with enthusiasm for life.